Hello and welcome to the Research 101 podcast series by the Academy of Nutrition and Dietetics. I am Jennifer Garner, outgoing chair of the Academy's Council on Research. This series will provide an overview of the research process and provide information on Academy research opportunities. You can earn 1.5 units of continuing professional education by listening to all 6 podcasts. During this third podcast in the series, I will be interviewing Dr. Christopher Taylor, who will share his advice on collecting data. Dr. Taylor is Professor of Medical Dietetics and Professor of Family Medicine at The Ohio State University, where he teaches a course on research design in medical dietetics and has spent 16 years exploring how lifestyle factors impact obesity and chronic disease. He also studies personal and cultural factors that impact disease, and his 2 major focus areas include food patterning and the influence of personal factors on lifestyle behavior choices. So, Dr. Taylor, thank you for sharing your time and experience with us today.
You're welcome.
My first question, in parts 1 and 2 of this series, we discussed strategies for not only planning, but also funding a research project. So now I would like to hear anything you can share on what tips should members who are about to start recruiting participants keep in mind?
Well, one of the great parts about designing the research study is, in reality, the collecting the data part and the recruiting of subjects really comes out of exactly what you're trying to accomplish. Because you'll set up your research question, you'll identify what it is that you need, and then from there you're going to set that, who is that patient population with your PICO statement? What is that endpoint that you're trying to change? Or what is the endpoint that you're just trying to assess? And then from there, you have to determine, so what type of information do I need? Who is it that I'm going to need to gather this information from? Where is it that we're going to need to find these individuals? If we're working with individuals that might be part of another organization, who are our partners out there that can also help us gain access to those populations? So it all becomes a very systematic process in terms of this is who we need to assess, this is what we need to do, this is how we need to then measure if it changes, and then all of those things that you've kind of come up with in your question really help lay out that process. So if you can develop that question, those lines of questions early, it really then helps you figure out your systematic process to go through to identify your patient populations or your clients or your organizations, the strategy, who you need to get, what you need to do, what you need to collect, and then those systematic steps to get to that endpoint.
Right. That makes sense. So I'm wondering, could you share a little any anecdotes regarding recruitments of studies that you're done or aware of, and any challenges that any of our listeners might face in recruiting participants to their projects?
Yes, and we always kind of have to think about who is that end user that we're really trying to reach. We've done some work in trying to identify patients in a primary care situation and trying to get them linked to nutrition counseling. So one of the things that we had to do was get the physicians on board, because we're essentially trying to recruit patients with hypertension and then try to get the doctor to then say, you're eligible for this study, would you be willing to participate? And then, so then we had to find the way, okay, we don't want the doctors to have to think, all right, does this person have diet or hypertension, and then what's the study, and then who is it? So one of the strategies that we then used was create that partnership so that we could screen the charts beforehand, identify who those patients that, based on their medical history, we'd be able to identify. Then the physician gets the list and says, oh, Mrs. Jones or my 4th patient, whatever, is currently eligible. Let's see if they're still meeting the eligibility criteria. Now we've then been able to kind of help that process, and then they're able to offer participation. And if that patient is interested, then they can bring them to us for the informed consent process. Because one of those important aspects of IRB is that we can't go out and barrage all of the patients within the health system, but the physician is allowed to provide that recommendation or bring them to us. So those are some of those kind of brainstorming things you have to do. Is there are going to be hundreds of patients that come in. What are the ways that you can then more systematically identify who would participate? How would you make that process happen? And then putting into place those mechanisms that allow you to get from identifying the target population to reaching the target population to then getting the information in front of them and then giving them the chance to agree to participate.
Mm-hmm. Yeah, and this has been mentioned in other parts of the podcast series too, just finding those collaborators, those partners. You're not doing this process alone. Very rarely, if ever, does someone do a research project in complete isolation. So I think that's such an important point.
Yes.
So once participants are recruited then, you're through that hurdle of the research process, the important work of collecting data begins. So could you speak to some strategies for collecting data of good quality and kind of what it even means to have data of good quality?
Yeah, and I think the first thing is to rein yourself in, because you get really excited that you can collect a bunch of stuff. And we get this idea of, oh, now that we have them, we could get this information, we get this information, we get this information, and then you start building and building and building. And then we end up creating a process of we're measuring our participants to death, and they then don't want to continue to follow through because now it was described as a little bit of a contribution, and now we've given them 140 pages of forms to fill out. So really kind of taking that first step of what is it that we want to know, what is it that we're going to measure, and then what's our best measure that we can use to be able to accurately and precisely measure that outcome without creating an exceeding amount of burden on either the person who's collecting it or the person who's providing the information. So it really starts with the planning process of when are you going to collect these measurements, how frequently, what type of measurement strategy will you use, and then putting that into place to make sure that you're doing it consistently, systematically, and with the least amount of burden that you have on the volunteer that's providing you this information.
Mm-hmm. Yeah, those are great points. And I think, talking from a researcher's perspective, it's always a little bit intimidating to think about, or frustrating to think about narrowing down which measures you're going to collect, because certainly once you put all this effort into thinking in advance about your project, you just want to collect as much data as possible and, make the most use of this opportunity. So do you have any advice for a novice researcher on how to narrow down what outcomes they're going to look at or what measures they're going to collect?
Yeah, and it is definitely efficient that if you have information that you can capture from an individual while you have them there, thinking about things that might go a little bit beyond your basic question that you can capture to say, we're going to do a questionnaire, we want to understand their self-efficacy, their perceived ability to carry out behaviors. So that might be our focus, but what we might also ask is, are they doing those behaviors and how likely are they to make changes in the near future? So those are ways that you can balance identifying what you're going to use currently, what might be the next step that you might use that data for, so that you might only start with the first battery of questions, but then you'll have the second battery of questions there. But you also have to keep that in mind in terms of, if I'm going to ask 5 questions on this, is it going to be that much more if I ask them 5 more questions about how much they were likely to do those behaviors? So being strategic around what do I need for now, what might be the next option, and then as you continue to add more things, how much more does that really start to add on to the burden of the person providing the information?
Yeah. There's also the issue of deciding, even if you have a certain outcome in mind, say, for example, some of the work I do is on fruit and vegetable intake, but there's a lot of different ways that you could ask people about their fruit and vegetable intake, for example. It's just one example of an outcome. So do you have any advice on novice researchers who are thinking about different ways to measure a single outcome? Is there benefit in measuring it multiple different ways? Yeah, what advice do you have in that regard?
Yes. And I think it becomes very important for us to try and find as many validated scales that we can use. As I was running this weekend, I was thinking of the question of, please quantify the amount of time that you pontificate on the quantity of mastication prior to gastrointestinal. And we get really bogged down in these really great questions that we think we're writing. And the individual has absolutely no idea that we're asking them, how long do you chew before you swallow your food? So we got to come up with the question that we think we're going to be asking. But then the way that that question actually translates to somebody, especially with issues around health literacy, becomes really important for us to use validated scales that have been tested before so that we know how they perform. We kind of automatically knee-jerk, oh, we want to know fruits and vegetables. We need a 24-hour recall. Okay, we're going to do a 24-hour recall. Well, that's going to take us 25 minutes, and then you have to analyze it, and then how are you going to tally that data? There are different screeners out for fruit and vegetables. The National Cancer Institute has a page that documents different types of validated scales for different types of behaviors, for individuals, for groups, for direct assessment, for screeners, things like that. So there are lots of different tools out there that you can use to collect this information without having to go so deep that you're gathering more information than you need.
Mm-hmm. So as we near the end of this part 3 of the podcast series, I'll ask a more general question. What are some barriers that members may face during data collection more broadly, and what is your advice for overcoming them?
Things never go exactly as you have planned, and that's why I think it becomes very important to, before you get started, sit down and go through the whole process. All right, we're going to identify this patient. So how do we identify the patient? We screen the chart, we tell the doc's going to ask them, they're going to say yes, they're going to come to us, we're going to do this, we're going to follow the screening procedures, they're going to get consented, and then they'll measure this. And then when are they going to schedule, when are they going to come back, when are they... So if you work your way through all the systematic processes and think about how are we going to facilitate their collection, they're coming back, all of those things, the more you can plan out what's going to happen and think about what might be the things that could go wrong, the more likely you are to kind of make it all the way through and to help foster them moving all the way through your study and getting the data you need.
Mm-hmm. So it sounds like what you're alluding to is what other interviewees have discussed, is kind of finding that mentoring team or finding those collaborators, because who would you posit might be helpful individuals to work with you through that process, especially if you are a novice researcher?
Yeah, if you're a novice researcher, and we've received this a lot, in fact, some of the work that we've done recently has been collaborating with our dietitians within the teaching hospital. They've got research questions in mind, and they say, I really don't know a lot about research, and I say, but you have the questions, and we can figure out a strategy to collect the data, analyze it, and really create that question. So we have created these relationships that they're our preceptors, and this is a way that we can give back to them. So reaching out to your local dietetics program where they're doing the research, a lot of times these turn into master's student theses, that they can get the clinical research questions done, and the student gets to also help with their research process itself.
That's really great. Well, thank you so much, Dr. Taylor, for sharing your expertise with us today and for being a part of this series. We really appreciate it.
Thank you.